Gibson Kohli here with Snackable Health. We are having a heat wave right now, Pyle, and what do we do, in terms of our medicines when it gets hotter out? What are your suggestions?
Yeah, Mike, it's been so hot all across the country, including here in Colorado, where we get this dry heat, not the humidity we see on the East Coast. But, I often talk to patients about staying out of the heat, drinking water. But one thing we don't think about is our medication. So, those of us that take chronic medications, it can actually increase our risk. For example, SSRIs, which are medicines commonly used for depression or anxiety, like Prozac or Paxil or some of those others, they can actually increase your risk of dehydration. Then there's other medicines that we use to treat hypertension, such as diuretics, which are medicines that make you urinate, excess fluid. And those can also certainly increase your risk of dehydration. There are medicines like ibuprofen that I tell my patients not to use as much during the heat because of those same reasons. They can also increase risk of cardiac arrhythmias. And then there's other classes of medications like those for Parkinson's that can actually impair the way that our body regulates our temperature or affect our thirst sensor. So really important to look at that medication list, talk to your doctor or pharmacist and see if you're on something that could make you higher risk for heat related illness.
A common theme there seemed to be dehydration. I think that probably underscores one thing you've been saying over and over again, the importance of getting plenty of fluids in.
That's exactly right. And unfortunately, what we do, Mike, and I'm victim to this as well. We wait until we're thirsty to start drinking, and by that point, it's actually almost too late because your body's chemical reactions have already indicated that you're dehydrated. So you really want to drink before thirst when it's excessively hot outside. You want to make sure that urine stays sort of like yellow or completely colorless. That tells you that you're, getting enough water. And then you want to also change what you're eating. I notice a lot of people go out to eat steak in the summer, go out to eat heavy meals. You want to go lighter on the protein. You want to eat kind of more, a little bit more carbohydrates, maybe that are easier to digest, more fruits and vegetables, and things like watermelons. And you want to keep the portion sizes small. So during the really hot temperatures, I actually may end up eating 4 meals, but they're all a lot smaller than my usual 3 meals a day.
I think the point about not waiting till you're thirsty is really important. I was out, of course, painting the other day in the sun, and I thought I was doing okay, but then I went to stand up, and I literally almost passed out. And
Oh my.
it's an important reminder that you cannot be that thirsty, but still get dehydrated. So I came back out with a big thing of water, and I was fine after that. But it really important to keep the fluids in. Thanks so much, Pyle, and thanks to all of you for joining us here at Snackable Health.